Raw meat on keto, ancient practice or modern health risk? By KetoNet. As interest in ancestral diets, carnivore eating, and metabolic health continues to grow, the topic of eating raw meat has re-emerged in wellness circles, particularly within keto and carnivore communities. Advocates often claim improved digestion, higher nutrient availability, and a more natural way of eating, while critics warn of serious health risks. So where does the truth lie? Historically, consuming raw or lightly cooked meat is not a new concept. Early humans lacked consistent access to fire, and many traditional cultures still consume raw animal foods today. Dishes such as steak tartare, carpaccio, sashimi, and traditional raw liver preparations have existed for centuries. Proponents argue that modern fear around raw meat may be overstated, especially when high-quality, fresh animal products are used. One of the main arguments in favor of raw meat consumption is nutrient preservation. Heat can degrade certain heat-sensitive vitamins and enzymes, particularly vitamin C, some B vitamins, and naturally occurring enzymes found in raw animal tissue. Supporters also claim that raw meat may be easier to digest for some individuals, as the natural enzymes remain intact and proteins are not altered through cooking. Another commonly cited benefit is the belief that raw meat more closely aligns with a species-appropriate diet, especially for those following strict carnivore or ketogenic lifestyles. Some individuals report reduced bloating, steadier energy levels, and improved satiety when consuming raw or lightly seared meats, particularly organs such as liver. However, these potential benefits must be weighed against very real and well-documented risks. The most significant concern with eating raw meat is foodborne illness. Raw animal products can carry harmful pathogens such as Salmonella, E. coli, Listeria, and Campylobacter. Unlike cooking, which reliably kills these bacteria, raw consumption leaves no margin for error, especially when meat handling, sourcing, or storage is less than ideal. There is also the issue of parasitic exposure, particularly with raw pork, wild game, and certain fish species. While freezing protocols can reduce parasite risk in fish, this is not always consistently applied outside regulated food systems. For individuals with compromised immune systems, the elderly, pregnant women, or those with underlying health conditions, these risks are significantly higher. From a nutritional standpoint, cooking is not always the enemy. Light cooking can actually increase the bioavailability of certain nutrients, such as protein and fat-soluble vitamins, by making them easier to absorb. Cooking also reduces the risk of bacterial load without necessarily destroying nutritional value when done properly. Importantly, there is currently limited high-quality scientific research directly comparing long-term health outcomes of raw versus cooked meat consumption in humans. Much of the support for raw meat diets is anecdotal rather than evidence-based, making it difficult to draw firm conclusions. In the context of a ketogenic lifestyle, it's worth noting that nutritional ketosis does not require raw meat. Keto benefits, such as improved insulin sensitivity, fat adaptation, and metabolic flexibility, can be achieved with well-sourced, properly cooked animal foods. For most people, lightly cooked or rare meat offers a safer middle ground, balancing nutrient retention with food safety. Ultimately, the decision to consume raw meat is a personal one, but it should be approached with caution, education, and respect for individual health circumstances. High-quality sourcing, impeccable hygiene, and professional guidance are essential if one chooses to explore this practice. As with many nutrition trends, the conversation around raw meat highlights a broader truth. Optimal health is not about extremes, but about informed choices, context, and sustainability. Disclaimer: this article is intended for general informational and entertainment purposes only. It is not medical advice, and it should not be used as a substitute for professional diagnosis or treatment. Always seek the guidance of a qualified healthcare provider before making any changes to your diet, lifestyle, exercise routine, or medication. Stay updated on the latest news, connect, interact, and more on KetoNet, available on the Apple Store and Google Play.